Welcome, everyone. We're just going to give everyone just a moment or two before we get started here. Just making sure everybody has a chance to get in. Well, thank you so much for joining our session on the physical therapy Q&A session. Exercise and sarcoidosis. And as some of you may remember, back in January, we kicked the year off having a discussion around exercise and sarcoidosis. And there were so many questions that we just knew we had to do a Q&A session as a follow-up to that. And so if you did not get a chance to see that session, we will send it to you in our follow-up email so that you can review that session as well and learn from the fantastic guidance that we receive from our speakers today. So welcome to Marion Patesnick and Claire Child, who are going to be guiding us through this Q&A session here today. We encourage all of you to put any questions that you have into the Q&A or the chat. We have a whole bunch of questions that were already submitted when you all registered that we'll be running through as well. But we're very eager to get started. Before we do, however, I want to just briefly thank our sponsors for today's event, ANI, aTyr, and Mallinckrodt Pharmaceuticals. And for those that don't know, just give a quick update on FSR and some things that are taking place here. So for those that do not know, the Foundation for Sarcoidosis Research is in its 25th anniversary, hence the 25 above my head. And we are continuing in our fight every single day to work for those that are living with sarcoidosis. And our mission is to find that cure for sarcoidosis and improve the life and care of those that are impacted by sarcoidosis. And we're very lucky to cooperate and to have collaboration with both clinicians, patients, researchers, and others in order to move this mission forward. Just a little bit about our community. Our community is 70,000 plus strong. We are represented across 50 states and over 80 countries. We are made up of patients, caregivers, family, friends, clinicians, healthcare providers, researchers, donors, fundraisers, volunteers, staff, and committees. What we do is we really focus on accelerating research, both by funding research and helping to run research projects like our patient registry, which is about to relaunch here soon on a new and exciting platform. We engage with clinicians by driving educational networking opportunities and educational programs for clinicians as we provide a space for them to build best practice sharing across their clinics around the world. We provide support for patients through support groups and community groups, through our patient navigator program, which provides one-on-one support, and wellness programs like today's program that we have for you. In addition, we do education through webinars, town halls. If you have not checked out the FSR Sarc Fighter podcast, you need to check that out. Get out there and check that out, as well as infographics. And FSR continues to advocate on Capitol Hill, along with at the NIH and the FDA, in order to help reduce access barriers or challenges for our patient population. For those of you that weren't able to join us, we already this month had a few other webinars that I want to highlight for you, and we'll drop into the chat where you could find those YouTubes of those sessions. We had a fantastic session by FSR funded researcher Dr. Gerke and her colleague Dr. Thornell, who really were able to talk about the results that came out of the research that was funded by this community, specifically focusing on environmental risks and causes for sarcoidosis. So if you did not get a chance to join, please check out that link that's in the chat. We also had a fantastic partnership session with the Cleveland Clinic, and you can see Dr. Logan Harper, who is a pulmonologist, and Dr. Sumit Sharma, who is an ophthalmologist, who joined this session in order to provide guidance around treatment and treatment therapies, and also understanding and detecting ocular sarcoidosis. As a reminder, we're still in the middle of Sarcoidosis Awareness Month. Our theme this year is Facing Sarcoidosis Together. So get out there, bring your community together, attend a walk or an event next week. This weekend is a big opportunity for walks. If you don't have a walk that you can attend, build one in your neighborhood, go out for a walk with your neighbors, and help raise awareness that way. You can light things up purple in order to raise awareness. And we've had lots of landmarks around the country that have been lit up purple. We're asking people to post in purple. So like Marion wearing your purple shirt and getting it out there to post in purple on social media, make sure to tag FSR at Stop Sarcoidosis, and make sure to use the hashtag post in purple, so we can continue to spread that awareness. Visit our awareness month page, attend our webinars, listen to our podcast, and follow us on social media. And one last reminder for everybody, June 28th and 29th, FSR will be hosting our global virtual patient summit. This is an interactive educational networking opportunity. It's on a special platform that allows for people to chat with each other, to make connections, to see booths that are made by leading experts with lots of resources and information. And we are building out the programming now, and we are really hoping that you will join us. And we put the registration link in the chat. There is a small fee associated with this, but if you are unable to pay the fee, there are scholarships that are available as well. So everyone is welcome, and we encourage everyone to be a part of this. And lastly, these are our social media pages, so you can follow us on all the different social media platforms. And we are hoping that you will, and like and share as often as you can, so we can continue to spread the word. Well, I would like to say a big thank you to Marion and Claire for joining us again here in April to celebrate Sarcoidosis Awareness Month. I want to give each of you an opportunity to open up by saying a few words that you would like to say to the community, and then we'll dive into some questions. So, Marion.
Okay, I guess I'll begin. It is such a pleasure to be here. I am so motivated and excited to work with this community. My family's been impacted by sarcoidosis. My dad had it, my grandmother had it. I've seen it firsthand, and I'm just really inspired by the people living with it, how they show up in their lives, and I want to help them continue to be their very best so they can do whatever they need to do. Yeah, I'm very honored to be here. Thank you so much for having me.
Absolutely.
And I'm Claire Child, and I'm also just privileged to be here. I am primarily here through working with Marion Patesnick, who was in our lab at the University of Washington when she was a Doctor of Physical Therapy student. She has now graduated and is working at a really wonderful outpatient pulmonary rehab clinic here in Seattle, Washington. My background is I am a board certified cardiovascular and pulmonary clinical specialist with, I guess now I've had that, I just renewed it, so I've had that for over 10 years now. I started and have always worked in the inpatient setting, primarily working with patients with advanced cardiovascular and pulmonary diseases, especially lung diseases, and patients before and after lung transplant and heart transplantation. So before coming to the University of Washington, I was at the University of Pennsylvania, and I was lead therapist there. They're also a very strong center with excellent clinical care for sarcoidosis before and after potential need for organ transplantation. Now I'm at the University of Washington, and I'm about to defend my PhD. I have a lot of interests in the use of digital health and different ways to increase access to physical activity types of interventions in people living with at-risk conditions. I'm really happy to be here. Thanks so much.
Thank you both for being here, for joining us again. There are already questions coming in fast and furious in our Q&A and in our chat. Just to quickly answer, yes, this recording will be made available for you along with the previous recording. So those of you that do have to maybe jump off in the middle, you can come back, or we're going to have lots of great information, so we might want to revisit this information as we're going through. So I'm going to jump right in, and Marion, I'll start off with you. Is yoga good for sarcoidosis?
That's a great question. Yoga is a great complementary therapy, I would say. So it's been shown to be, we don't have any tests with sarcoidosis and yoga exclusively, but we do have tests with similar chronic diseases. And yoga has been shown to improve, I believe, pain. I do actually have notes on it. Pain and fatigue. Let me double check that for you, though. Yeah, yoga has been shown to improve sleep and decrease fatigue, improve flexibility, but there are some things that you might want to consider with yoga. Sometimes some of the positions, you can be inverted for a while, you can be holding your breath for a moment. Those are not advisable for people with sarcoidosis, especially with lung involvement. If you're just stepping into yoga, I'd recommend doing more gentle yoga, such as hatha yoga is a bit more gentle instead of maybe more advanced like hot yoga. Chair yoga is also accessible online. So those are some great options for you to check out.
Fantastic. And Claire, is there anything you wanted to add in there?
No, I think that's fantastic. I think being aware of your shortness of breath, being aware of your level of exertion are really helpful, not just with yoga, but really with any activity. We generally recommend that folks keep their shortness of breath less than maybe a 4 out of 10, so in that light area. And then as far as exertion as well, I think really the evidence is showing that if you keep your exertion levels in that low to moderate range, then you're probably safe with whatever activities you choose to do.
Thank you so much. And so as you were talking about that, one of the questions that we had received was around the ideal time and frequency for movement exercises and how you can start to build up endurance. And so, Claire, do you want to start us off and then Marion, you can chime in?
Yeah, definitely. And we have so much research to support in the normal, healthy adult population. I'm sure you've all heard this. There's been a lot of like public health push for, physical activity guidelines for how to get to those 30 minutes, at least 5 times a day of moderate intensity. The goal, 150 minutes of at least moderate intensity of physical activity per week. But we know that that can be really challenging or even a bit maybe overwhelming to think about, doing that level or that volume of activity right away. And so there's some really helpful guidelines in both cardiac and pulmonary rehabilitation literature about how to progress from where you are to where, to that stand, of course, that ideal standard. You can start with generally interval training is helpful if you're thinking primarily about like aerobic. First, maybe a minute. What I mean by interval is short periods of intensity, a minute to 3 minutes, working up to consistently doing something for 3 minutes. That's around the point where you start getting that aerobic exercise benefit. And then taking rest breaks. You may need to take a little bit longer of a rest break, and that's okay. But then with interval training, you'll have an on phase where you have, up to 3 minutes of activity, and then a rest break, and then another on phase, and then a rest break. And really, that kind of modality is consistent across walking or biking or anything, even sitting in a chair or standing to do your activities of of daily living, getting ready for the day. Using interval training can help, and it's okay to take rest breaks. In fact, it's important in sarcoidosis to do that.
Thank you so much, Claire. And Marion, is there anything you would like to add there?
Just that yeah, I thought that was brilliant with the interval training. Sometimes it can be difficult to get in, a 20-minute walk seems very daunting and overwhelming, but maybe 2 10-minute walks seem less intense and overwhelming to you. So think about maybe taking little exercise snacks instead of like a huge long walk, breaking your walk up into some smaller walks if that's more doable for you.
Fantastic, thank you. And so, Claire, building off of that, tendonitis caused by sarcoidosis has been a challenge for some of our patients. How do you recommend that they start to address exercise?
Yeah, so in sarcoidosis, we know, of course, that the inflammation is part of living with the disease, and that can be in tendonitis, that can be cutaneous or skin manifestations, can be in the lungs, can be really in lots of different areas. During a flare-up of your sarcoidosis, there's very often an inflammatory process going on. And that does often, and according to the literature we do have, changed the approach a little bit, especially based on where your flare up is and whether or not you're on corticosteroids. So I think for a long time there was some real hesitation to exercise during a flare-up. But in the more recent years, we're seeing in the literature we have and the clinical trials we have that there is benefit even during a flare-up of physical activity. You probably should not be doing the more intensive, moderate to or vigorous physical activity, but backing off to more of a light intensity. Again, kind of using those scales of how you're feeling to guide your intensity. And there's actually more and more evidence coming out that even if you're on corticosteroids for the inflammation or the tendinitis, that there's benefit from staying active, again in that low intensity range, and you can try to stave off or limit some of those effects on the muscles from the corticosteroids, muscle loss, atrophy. And then as far as pain control goes too, I think for a long time with like tendinitis, there would be guidance away from if you're in pain, you have this acute flare or this really painful tendon, to not exercise, to rest. And now we know that there's benefit in doing some activity, even with that acute tendinitis, maybe range of motion, more body weight type of supported exercises, and probably not doing a lot of heavy resistance types of strengthening exercises, but thinking about ways to modify keeping active so that you don't lose the fitness that you have during that flare up. I know that's really hard to do when you're in pain, and certainly talk to your doctor about an approach that's best for you and your needs if you have tendinitis, especially if it's recurrent. But yeah, as we learn more about that inflammation, the pain that is present, there's so many benefits to staying active and not the real risks or challenges come from inactivity. So we're trying to limit that, which is again a lot easier said than done because we don't want to move when we're hurting or we feel fatigued. But it's still very important to stay active.
Thank you. And Marion, I want to build before asking you to add any additional thoughts you have on that as well, to whether one of our patients had noted that when they stop exercising, that's when they're more at risk for a flare or injury. Does that sound right? And if so, why?
Yeah. So one thing we notice, especially with chronic like autoimmune diseases, is we'll see this like boom bust cycle happen where people will be feeling good one day and they'll be like, okay, I've got to catch up on everything. And then they end up kind of overdoing it. And because they feel so good, and then they end up being very sore, and that leads to them not wanting to go back and do the next thing. And it can kind of be this like vicious cycle of people doing a lot and then really paying for it the next day. So something we really want to advise people to do when they're with tendinitis or anything is to break up big activities. Like if you've got something major, especially if you've got tendinitis and say your calf at the back of your Achilles tendon, or wherever it might show up, maybe break up big walking activities so that you don't have to push that tendon really hard. Think about your day and kind of strategically plan, how can I not overdo it on this one particular part of my body. And sometimes it can be a whole systemic thing. You need to take your day, plan your week. I know we talked about this planner, Trish and I before time, but you can plan your day to work with your body, because that's where we're at now. Sometimes people, they can be really motivated at the last minute and want to do everything right at the last minute, but that just isn't the way it can work for sarcoidosis patients because we're dealing with this chronic fatigue. So what we advise patients to do is make a list of everything you have to get done that week and list out those must-do activities, your appointments, your absolute have to do things. Then list out your nice to do activities, the things that you're hoping, coffee with friends, that kind of stuff. And take one thing from your need to do activity and put one item on Monday, then take another item and put it on Tuesday, and take another item and put it on Wednesday, so that way every day you're getting one need to do activity done and you're not overdoing it. This prevents the risk of overdoing it, and I think it just makes you more aware of where your energy is throughout the week. So I think that's a helpful tool for anyone facing tendinitis, facing general fatigue, cardiac sarcoidosis, pulmonary sarcoidosis. Look at your day and and try to be strategic and work with your body.
Thank you so much. And I want to kind of stay on this topic of fatigue because we're getting a lot of questions around that. Some people saying that the pain is not as bad as the fatigue, that the fatigue is just overwhelming for them. What are, some really concrete things that you would recommend for being able to exercise when people have fatigue or take care of themselves in terms of the fatigue? And Marian, I'll go to you first this time.
I think breathing exercises are fantastic for people with fatigue. And I think it's important to recognize too that rest and recovery is part of your body becoming stronger, and that it's okay to rest. Build it into your time in that weekly planner. At the same time, make sure every day that you build in some good intentional rest, because it's important for your body to have time to recover. I'm sorry, what were we talking about again? Oh, I'm sorry. You're muted, dear.
Fatigue and concrete ways that individuals can still exercise if they're experiencing real fatigue and when they should know to take a break.
Okay, I appreciate that. Thank you so much. I think it's important, one, to listen to your body and try and take breaks before you think you absolutely need them. So once you notice that increased in shortness of breath, sometimes you get that mental brain fog where all of a sudden, you pay attention to these like little signals. When your body whispers, try to listen so that your body doesn't have to shout at you to stop. I think that's number one. Number two, breathing exercises. I know we mentioned pursed lip breathing, deep abdominal breathing. Those are great. Range of motion, just gentle arm circles, anything to preserve that range of motion is excellent for you. Those kind of things are really well documented. Just like Claire said, we used to think don't exercise. Now we think just be gentle and listen to your body. And then I would also say, when you think you've overdone it and you think you're in that flare, or maybe you think maybe you're just in a flare and maybe you have overdone it to kind of like kick it off into a flare, take a second and reflect on like what did I do, or like how could I have done that differently? Who do I need to ask for help next time to like avoid this overdoing it? I think those are all really proactive ways to look at your situation and do better. One last thing I want to mention, because I know yoga was mentioned. Tai Chi and Qigong are other breathing practices. They're like Qigong can be like breath and just gentle arm motions. It can all be seated. Those are not really well researched, but there is a small body of evidence to suggest they're good for fatigue, and they're good for improved sleep quality, which will help you recover faster.
Thank you so much. And Claire, anything you want to add in about any concrete exercises or concrete activities that people can do to continue to exercise while facing this challenging fatigue?
Yeah, thank you so much, Marian, for your excellent insights. I'll share that fatigue in sarcoidosis, while there's not a lot of literature, and I saw in the chat there was a question about what I'm referring to. I'm happy to share the recent systematic review that's really helpful. There is some for fatigue, and the benefit of physical training is most significant for fatigue in sarcoidosis. So that's positive to know. I think again, the most significant amount of evidence is for that, trying to get to that moderate intensity if possible, to improve the cardiovascular fitness primarily, and also with some additional peripheral muscle strengthening. But the other thing that is mentioned in this recent review and the literature supports is that fatigue is really multidimensional in sarcoidosis. And I know I'm probably preaching to the choir because you all know this, but there's a lot of things that are known to contribute to that experience of fatigue. And that includes the involvement of muscle. It includes the potentially the role of corticosteroids. It can include pulmonary function, cardiac function, and then also just systemic inflammation itself. All of the different cellular mediators that happen in inflammation lead to an experience of fatigue. So talking with your doctor and understanding the fatigue that you feel, and if any of it can be medically managed, that can be helpful because then the activity related or the aerobic training portion, which is the our bodies access our aerobic metabolism when we are moving, and so that aerobic activity element really can then be targeted if those other causes of the fatigue have been minimized. So there's hope there. As far as dealing with it pragmatically, I think that knowing, again, talking to your doctor, knowing the different contributions to your personal experience with fatigue, and then also knowing your own, what works for you. Are there times of the day that are better? Are there days of the week that are better? What are the other activities that you need to do? Sometimes you've got to go to work and you've got to make money to afford to live and have insurance, and you've got kids or you've got loved ones or people, friends. There's so many demands on our time. And so it can be really challenging, I think, to kind of think about, rationing fatigue, which is often described, and or rationing energy, which is described. So I think knowing what your experience with fatigue is, and then start where you are. Start with these exercise snacks. Don't start ambitiously like in the new year I'm going to do, you know, I'm going to commit to this
CrossFit.
really intense, yeah, program. No, start where you are. Start with exercise snacks and then progress from there, because every little bit does matter. And you'll start to notice, maybe some of you can attest to this, you'll start to notice the little bits of additional energy. It happens over time. It's not like a one-time experience, but that's what I would say is know your own experience with fatigue, know what elements contribute to your fatigue, and that can involve talking to your doctor, and then start where you are. With allotting a little bit of that energy each day to exercise.
And I want to build on that, Claire. We've gotten a lot of questions about people who, at their current state, don't feel comfortable safely walking across the room or across their full house, or they have challenges. A lot of people noted they're having challenges with stairs or lifting themselves out of the tub. How would you recommend, what specific kinds of things would you recommend they start with? Again, obviously talking to their doctors, but what kinds of specific exercises would you say they should start with that would help them over time build that strength? And then, Marion, I'll follow up with you for additional insights. So, Claire, why don't you kick us off?
Sure, yeah, and working in the hospital setting clinically for much of my career, I can say that this is one of the main things we're working with patients is helping them to get home, and we know that once you do get home, there's still additional needs when you're living with a chronic condition. So you can have good days, bad days. Um, we know that activities like standing up from a chair do require a lot of proximal muscle strength. And what I mean by that is muscles that are in your core and in the part of your legs that's more close to your core, your pelvis, that area. And so standing up from a chair really does require your hip muscles, your quad muscles, your hamstrings, your core. And we also know those are unfortunately the muscles that are most affected by corticosteroids as well. And it's one of these unfortunate, of course, side effects. So, what I would say is if you're having difficulty with that, start simple with slow, supported sit to stand type of activities. Often the challenge can be kind of, I don't know how many of you do this. You're like, you kind of quickly sit. Lowering, or what's called eccentric control, lowering into a chair can also be hard. Or maybe going upstairs is something you can do with a rest at the top of the stairs. But going down the stairs is something that you're really nervous about because you feel like you might fall or it's really taxing. And so eccentric or practicing standing up, but then also in a safe environment, sitting back down, you know, again, slowly, that actually builds your muscle strength, it builds your endurance. And that alone, especially if it's been hard for you, could be the equivalent of a moderate intensity activity, right? We often think of walking and, heart rate being really high as like that moderate intensity. But for someone who, sitting, standing, and walking across the room is challenging, that actually may be for you that moderate intensity. So being aware of that, where I might recommend if I'm working with a patient that has the goal to get a little stronger with those, a little more comfortable with those activities, standing up from a chair, short distances of walking, rest breaks. If you're having difficulties going up and down the stairs, perhaps just train intentionally one step at a time, going up, coming back down slowly, going up, coming back down slowly, keeping breathing control, working on both legs. That might be something that you can do. And then lastly, I'll put a plug, of course, talk to your physician, but you can also see a physical therapist. They can come into your home. There is home physical therapy if you feel like you can't get out of your home easily. And there are just some fantastic providers out there that can come to your home. Or if you can make it to an outpatient clinic, you might have more equipment available there. But, I think people who are maybe more limited in getting outside of their home feel like they don't have as much access, but there are options. So speak with your doctor about maybe getting a home physical therapist.
Thank you, Claire. And I just want to clarify when you're suggesting people do sit to stand exercises that should be on a stable chair with arms or with the support of someone around them. If you could just give a little bit of clarity on that.
Yeah, so I always recommend having someone around you when you're starting to exercise in case something happens. You should have a family member or someone else around you because exercise does increase some risk. And it's just a generally good idea. So same for me. I let my husband know when I'm going to get on the bike or whatever, right? And then as far as a chair to use, yeah, don't use a computer chair like I'm in with the wheels. A secure, stable chair with armrests is preferred. And if you're finding that it's difficult to stand without the use of your arms, you can use your arms. You want to stay close to that chair, not far away from it. And you can, if you have that kind of safe environment, sturdy chair, you can stand up and then you can sit down. If you have a device that you use to walk, like a cane or a walker, I might advise you to talk to a physical therapist about the best place to do these. But if you don't use a device, this is a relatively safe activity for you.
Great, thank you. And Marion, I see you on the stairs, so I'm anticipating that you would like to show some tips for people as they face the challenge of going up and down the stairs.
Yeah, absolutely. I've got some fun ones for home if you've got steps that are a challenge for you. I just want to mention that you should always talk to your doctor before you exercise. It's very important to get cleared for exercise before you start. Everybody with sarcoidosis is different, and you just want to make sure it's safe for you. So some good stair ones. One thing we notice with people is that knee stability as people are going down the stairs can be a real sticky wicket. So I've got a good one for you to try. I want you to come to your stairs with the railing. Hang onto your railing. You're going to come up to that top stair and slowly lower yourself down and work on that knee stability as you slowly lower down on one leg. And you'll do, I don't know, maybe 10 on one leg, and then you'll switch and slowly lower down on the other leg. Things to keep in mind. As you lower down, you want your knee in line with that second toe. Oftentimes with hip weakness, we can see the knee start to cave in. So you want to see the knee in line with that second toe as you're descending. So that's a good one to try. And then if you want to, you can even try going laterally and stepping down this way, slowly lowering down, keeping that knee in line with that second or third toe, and then coming back up, because that knee stability is so important. Another one I think is a great one to add is we talk a lot about walking. One way we can make our walking more efficient is by effectively transferring that weight from our heel to our toe for a good push-off. And hopefully I can demonstrate on my stair. Hopefully I'm high enough here. So what I mean is a lot of times people, as we age, we get these little shuffle steps. Do you know what I'm talking about? So what I want you to think about is taking larger steps so that you cover more area with less steps, and that'll be more efficient. So you'll weight shift from your heel to your toe, and that translates to a better push off. So you get a better, longer step. So one exercise you can do at home, if you've got a countertop, I wouldn't do it on the stairs. I would do it on a countertop and hang onto the countertop, and you'll shift your weight from your heels all the way to your toes and slowly lower down. And practice, I don't know if you can see me here, practice feeling that weight come up into the toes so you get a good push off when you're doing your walking. So those are just some nice tips to think about walking and getting stronger. Thanks.
Thank you so much. That was good. And we were looking for, a lot of people were looking for some very practical things that they could do. A reminder to everyone, if you are doing any exercises on the stairs at all, for sure have someone around you. That is one of the most dangerous places in everyone's home. So make sure that you have a railing and someone with you that can make sure that you're safe, and of course get that cleared through your doctor. We always want to make sure that everybody's thinking of that. You know, something that came up in a number of the questions that we received, and a couple in the chat that we've had so far, is around core strength. And Claire, you started to mention core strength in terms of something that people need to think about as they're thinking about ways to improve. Besides the exercise that you guys already noted, are there other exercises that you think are good for core strength? And Marian, I'll go to you first on this one.
Okay, I think honestly, there's so many wonderful ways to work your core. It kind of depends on where you're at. If you are seated and this is already a challenge, pulling your back away from the backrest, you can just try reaching laterally and even try crossing your arms. Walk your hips forward so your back is away from the backrest. Try crossing your arms and lean back until you feel that backrest, and then contract your abs to bring yourself back to seated. Sometimes this is one I'll see people do this. So avoid that. Let it all come from the abdominals. But you can try doing some oblique work, just going side to side, or even stretching down towards the floor. Or you could try just some leaning in the chair to get some abdominal strength. If you're like, that's not enough for me, I need a little more, Marian, I got you. Okay, so what you can do is come to your countertop and do a plank, and you can try some alternating taps. If this is not enough for you and you still are looking for more of a challenge, I don't know if you can see my leg here, but I'm going to lift my opposite leg up even, and that's going to challenge my core. So you can try alternating lifting your legs up as a possibility. I'm going to popcorn it over to Claire. I'm sure she's going to have some good ones for you.
Yeah, well, I'll just add, I think great suggestions for sitting and even standing. You can also start in supine, and I'll say from my experience, there's almost no one that I've ever seen that doesn't have core weakness or fatigue. And so sometimes just starting laying down or supine, and I don't have good camera type of to demonstrate this, but laying down, putting your knees up into a knee bent position, that can help. And then putting your hands on your belly while you're laying down, and just think about rotating your hips forward and backwards. And you can try to feel your abdominals kicking in. You can even time it with breathing as well. So as you're breathing out, you're drawing in your belly, and you're getting a little bit of a contraction of your abdominal muscles right there. It's really nice to pair it with diaphragmatic breathing, trying to get that diaphragm to initiate. So what I mean by that is there's a big muscle at the bottom of your lungs, your chest area, that does the majority of breathing. And so you want to be, when the diaphragm is activating, you're actually breathing into your abdomen. So you're kind of pooching up your abdomen like this. And then as you're breathing out, you're trying to activate and shorten that abdominal muscle. You can hold it for a couple seconds. Don't hold your breath, but hold that contraction there. And that's a way to kind of get those, we call them the deeper stabilizer muscles that are really important for walking, standing, etc. So that's really good. Pair it with diaphragmatic breathing. Another option here is you can start with contracting that abdominal region. And then from there, with that, this is tricky to do, with that abdominal muscle kind of stabilizing your core, rotate your hips side to side. Still breathing. But what that does is activate some of your lateral abdominal muscles and your hip muscles, controlled, slow, not fast, not this, right? But controlled. And that will really translate well then into seated and standing activities, like Marion was saying. And those are hard. They're hard for me to do.
Yeah. And so Claire, I just want to clarify, you're saying to do that when they're lying down, right?
Yes, so I would encourage that lying down. Still a good idea to have someone close by around anytime you're exercising. But that one, again, if you're focusing on your breathing and your someone is around that's very low risk, you're not holding your breath. That one is something pretty much everybody needs to do. Oh, I think you're muted.
Sorry. A couple of people had noted, unfortunately, that through their steroid use or other challenges, that they have had increased risk for fall or increased risk for breakage because of something like osteoporosis or other challenges. What precautions should people take if those are a risk for them? And Claire, why don't you kick us off this time?
Sure. Yeah. And again, corticosteroids are sometimes kind of like that we call it in medicine, like a necessary evil. It treats the disease and helps with, with progression or challenges or flare-ups, and pain, but then there's some negative side effects. So similar to preserving muscle strength, there are some strategies you can talk to your providers about. I know there were some nutrition questions as well, about, optimizing your bone health. And we are not nutritionists or physicians, so can't really comment a lot on that. But making sure you have those on board, and maybe speaking with a nutritionist to optimize your diet is certainly one way to prevent osteoporosis and prevent complications from it. And then physically, though, there are benefits. We know that weight bearing, so what we mean by that is standing on our legs. If that's challenging for you, sitting does also help support some loading through bones. Bone responds to pressure or force that's made on it. So weight bearing is ideal. Walking is helpful for prevention of bone loss. And then in addition to that, we talked about the sit to stands. That's one activity that can help. If you're able to stand again with someone around you with support that's stable, like a countertop or something like that. I'm going to use this chair because it's what I have right here. That's the size it goes. I'm going to turn it around. But let's say this is a countertop. What you can do is mini, not deep, not really deep. There's not a competition. Mini squats. Really, really good for loading those big bones in our femur, our legs, loading that bone, helping with bone growth. You could do, at least 10 of those. You can do it several times a day, 3 times a day, morning, lunchtime, maybe you're in the kitchen, maybe you're in the bathroom. And if that seems easy for you, then you could progress to walking. Walking is really helpful for loading those joints. And also don't forget about your arms. You can do some loading in kind of that plank position, doing the activities that Marion was talking about. Also, like a mini controlled push-up could also load your arms and prevent osteoporosis there.
And Marion, anything you would want to add in?
Yeah, one exciting therapy. It is available is whole body vibration training that we use in our clinic. And it does provide, just like Claire said, your body responds to that stress. So it provides just the right amount of stress by shaking you around a little bit to your bones, that your body will put a little more bone mass on, and it doesn't cause as much shortness of breath, which is really exciting. So that's a great therapy. Additionally, it has some benefits for balance as well. So those are some good ideas to check out.
And so, in terms of balance, we have had a few questions that have come in with regard to balance and challenges when people are experiencing dizziness. What kinds of recommendations do you have for people thinking about whether one person had talked about feeling lightheaded when they were on the ground, and how do they get back up if they don't have things around them that can necessarily help them get back up? Or another was talking about balance problems and not being able to use things like treadmills or things like that. How do you help people think about dealing with when they're having balance challenges? And Claire, I'll let you start this one first. Yeah.
Sure. Yeah, this is a challenging one because the dizziness can be from a number of reasons. And again, we would recommend, typically if it's a new symptom of dizziness, you don't know the cause, that is a reason for more of an emergent situation. If you have not had that dizziness before, if you have fallen because of the dizziness, or if you've lost consciousness, the medical term for it is syncope, so you briefly lost consciousness. That is a medical emergency, so definitely call for help. Um, it is usually a contraindication for exercise as well. What I mean for that is it's a reason if you have fallen from standing up, it's your body's not able to respond to additional work in that moment. There's some reason that that you did have that dizziness that resulted in a fall. So that is what I would say first. That's kind of one of those red flag things where you do want to seek immediate medical attention. That's like a 911 situation. If you have dizziness that has already been investigated by your doctor, and it's relatively stable, you know when it comes on or whatever, I would recommend exercising in a supervised environment. So that would be in a pulmonary rehab type of a setting or with a physical therapist where there's help available. Again, because dizziness could be an indication something's going on with your heart or your brain, and it can be very serious. I think you mentioned like if somebody has fallen and can't get up, or there's maybe some other kind of challenges related to the dizziness. There are strategies that we can teach people who have falls risks in physical therapy for how to get up off the floor. But just in the interest of kind of minimizing risk here on this webinar, I would recommend if you do have that problem that you talk to your doctor and you get a referral to a physical therapist. It can be, I recognize, I acknowledge that can be a real challenge. And without knowing the cause of it, I would say talk to your doctor, and you can have the physical therapist can also look at a lot of those contributions. What are the issues going on? Why are you at risk for falls? What's the dizziness? Is it blood pressure dropping? Is it something related to your heart? Or is it, sometimes people have what's called vestibular, it's that inner ear system. They have problems with that, which causes dizziness.
Thank you. Marion, is there anything you wanted to add?
I thought Claire did a great job, but dizziness comes from a lot of reasons. Just make sure you get checked out and that you're being safe. I think just what she said, fall recovery is something that we work on in physical therapy. It's hard to make general suggestions over the internet without, like during a webinar like this, without knowing your specific needs. But definitely contact a physical therapist if you are want to get up off the ground. They can train with you. That can be like a goal, and you can work together to get that done. But yeah, it's kind of hard to suggest something right now. But I think those are great suggestions.
Can I just add one thing? And that is, you mentioned, separate from the dizziness issue, concerns about like getting on a treadmill, maybe having some instability and concerns about that. There are other ways to get that exercise benefit. And so you may look into, there are some nice seated ergometers that you can do from a chair. I've seen some kind of step in place doing while seated, kind of repetition. So those can provide some benefit of getting your heart rate up, your exertion up. Seated recumbent bikes they're pretty inexpensive now. I've been surprised they're more and more accessible in your home. They do take up like a bit of space. But you can talk to your doctor. There's other options other than like a sitting upright stationary bike, like a Peloton, which not everybody can do, or a treadmill, which again, not everybody can do.
You can do seated kickboxing as well. That's another great option to get your heart rate up. It won't work your legs, but it'll get your heart rate going, which is great. And if you have a person with dizziness, that's a good option.
Thank you so much for that. We got quite a few questions around lymphatic drainage and swelling, and whether either of you know whether this is a good option for people to explore in order to address some of the challenges they're feeling, pain, fatigue, and possibly also joint pain and other things like that. Marian, I'll go to you first, and then Claire, over to you.
Honestly, I am not a lymphatic drainage expert, and I
Yeah,
hesitate to speak on that
no, fair.
because it's not my specialty.
Perfect.
But I do know that you could talk to your doctor about compression socks. Sometimes that can be helpful before exercise. Other options, I do know whole body vibration training is sometimes used for lymphatics, but I don't know the research off the top of my head, so I hesitate to
Nope, perfect.
use it as a modality. Yeah, I mean, Claire, do you have any other?
There are physical therapists that are trained to be lymphedema specialists.
Yeah.
So there is a condition called lymphedema, which is unique compared to maybe like a joint that's swollen. Um, like if one knee is swollen, not both knees, that can sometimes be treated in a different way than what's called lymphedema, where there's a collection of additional fluid and cells in the lymphatic system. And those physical therapists go through additional training and often get an additional certification in management of that type of swelling, which does respond very well to compression. And you can get even more additional compression than what's available like on the internet. But I would ask for a referral to a lymphedema specialist who's a physical therapist if you do deal with that.
So kind of building on that, we did get a question around, is there somewhere that people can go to identify where there might be pulmonary rehab clinics, or in this case, like lymphedema specialist? Is there a website that people would be able to go to try to identify somebody for that?
Yes, there is. And I can share the link. I'll have to find it, but the American Association of Cardiovascular and Pulmonary Rehabilitation maintains a registry. It only shows the sites that are registered with them. Mariana, I think your clinic is.
I'm actually not sure. That's a great
Yeah.
question.
And then as far as people who are lymphedema specialists, I believe there's also on the American Physical Therapy Association website a link for searching for people that are lymphedema specialists in your region. This is
Thank
just
you.
for the
Yeah.
United States. I don't know if we have people joining from other countries.
If you would be able to put that link into the chat, Claire, that
Sure.
would be great. I think people would be very interested in learning
Okay.
a little bit more about that. We also had quite a few people that both submitted questions and have submitted questions now here live around joint pain and what people can be doing to deal with either arthritis or specifically joint pain when they're exercising. And so, Claire, do you want to start us off with any recommendations around joint pain itself?
Sure, yeah, joint pain. So with that inflammation, often there's a symptom of pain, and it can be really uncomfortable. And I know it's something that probably many of you live with. We know that from a modalities perspective, acute pain, which means pain that's come on in the last maybe 7 to 10 days, is responsive to cold therapy. So like an ice pack could be helpful. If it's in that kind of acute, hot, angry phase, I would not use heat. Heat can actually potentially make that worse and increase circulation to that area and swelling. So ice can be helpful for that. And in addition to that, you can also use compression, potentially elevation and rest. Rest not meaning, rest, ice, compression, elevation. Rest doesn't mean stay resting forever. Stay moving, stay active. But those can be some helpful ways to manage that yourself. And then, typically, and this is something we do see, if you've had that acute flare and then you're easing up from it, maybe you are taking steroids, there's going to be potentially some loss of that muscle in the region. Our muscles fire differently when there's been swelling in that joint. So you may then want to increase, typically around that 4 to 6 weeks phase, increase activity again, and then do some strengthening around that joint. If, let's say, it's your knee, it can be some strengthening of the quad muscles. It can be strengthening of the muscles around the ankle. And again, ideally, you could work with a physical therapist. If you don't have easy access to someone like that, then we've talked about some exercises that can help, or you can also talk to your doctor about some options.
And for those that didn't see, Elise, thank you, Elise, for putting into the chat the American Association for Cardiovascular and Pulmonary Rehab that people can find to be able to help find them some options. Thank you so much, Claire. Marion, anything you wanted to add into that at all?
Yeah, actually, great job, Claire, as usual. But I just want to add that the American Arthritis Foundation does offer aquatic classes. I'm going to put the class locator in your chat right now. Just a consideration to keep in mind, if you're a person that struggles with shortness of breath, make sure you keep the water like waist level and down. You don't want the hydrostatic pressure pushing on your rib cage and making it harder for you to get a breath. But I have had some patients and they've really loved these classes. This has been a really nice addition to all their walking and everything, to take some of that weight, that load off those joints and keep the range of motion going. It's just a great opportunity. If you can get in there, I'd recommend it.
Great, thank you. And so some people did note that there's lower back pain and wanted to know is that something that I don't know whether you would be able to answer this, it's more common in sarcoidosis, or is it something that there are exercises that can help that would be friendly to sarcoidosis patients?
Well, honestly, I guess I'll start, but I
Yeah.
think any of those core exercises are going to be a great way to support your back. The sit to stands too. I know it sounds silly, but when your glutes are stronger, you can pick up heavy things with your big strong glutes, and you don't have to compromise by slouching over and using your back muscles. When you have strong enough hips, your hips can take that load, and your back doesn't have to. So I guess my best suggestion would be to get a stronger glutes and backside, and work on that core stability so your low back can just be static and not as under so much stress.
Well, I can't believe we're coming to the end, but I want to get to the two last questions that were in the chat that I promised to answer live before we do. So I'm going to ask each of you to answer one of them. So Marion, I'll ask you to answer if someone is having trouble getting to the bathroom on time and that pelvic floor kind of component, are there exercises that they should consider for pelvic floor exercises?
Okay, that's another one. There are specialists in physical therapy. I'm going to recommend you see a pelvic floor specialist. They are awesome. And I just want you to know that the hypoxia that makes you short of breath, that can also impact your pelvic floor muscles. And just know that that can be a part of it. And yeah, that there are pelvic floor specialists that can help you strengthen and tighten those muscles. And there's help out there for you. So don't be scared to reach out.
Fantastic. Thank you for that. And then the last question we had, Claire, I don't know if you know about this. I realized that it was Marion who brought it up, but around vibration therapy, could you say a little bit more on where people might be able to find additional information about vibration therapy?
Yeah, the vibration therapy, actually, I think it came from like in spinal cord injury, where people really do deal a lot with osteoporosis and loss of bone mass, and it's really interesting. So you could actually call around A lot of people just kind of go to the closest PT clinic, but you can actually call clinics and you can ask if they have the whole body vibration therapy, and they'll respond. So you have a choice in where you go, and you can take a a referral, or you can go direct access to any clinic really, and they should be able to answer if they have the whole body vibration therapy.
Fantastic. And I know we didn't get into great detail on energy conservation, but Marion, I know we're going to bring that back up at a different time, either through another webinar or as a session as part of the summit. So more to come. We will keep everybody in the loop on that. That will hopefully help everybody. But we are coming to the end, unfortunately, here for our session tonight. But I just want to say a big, huge thank you to both Marion and Claire. Any last words from each of you as we close out this evening? And Claire, I'll let you start off, and Marion close us out.
Sure. Well, your questions are so insightful. I'm so grateful for you joining and for wanting to learn more. I think this is the first step. You're taking charge of your own physical health, and I always tell my patients, I say, you may not be able to control some of the medical side of things, but physical activity is something that is it's something we can control in a way. There are certainly complications, but it's something we choose to do. It's a behavior, and we're cheering you on. So start where you are, as we talked about. Start with what you can do. Make sure you do have someone with you, and your doctor is okay with you exercising, especially if you're going to be doing more aerobic or higher intensity exercise. But start where you are, and we're cheering you on.
Wonderful. And Marion had to close us out.
Yeah, I am just so thankful for this opportunity. And I know the Foundation for Sarcoidosis Research celebrating 25 years, which is so amazing. And I just think this is such an important thing for people with sarcoidosis to keep coming together. When we come together, we win. And I'm just so grateful for this opportunity to come together and fight and win with all of you today.
Thank you so much. Yes, we're going to face sarcoidosis together, as our theme for the month says. Please get out there, raise awareness. Thank you incredibly so much to both Claire and Marion for your enthusiasm that you bring, and these really very beneficial tips, and giving very concrete exercises that people can think about, the guidance on talking to their doctors as they're working through this. We're getting tons of thank yous in the chat from lots of different people. So thank you so much for being available to us, for taking the time to do a Q&A session following that incredible session we had in January. To anyone that attended, we will be sending the video of this out, as well as sending you some additional information and the recording from the previous session. So hang tight. We'll be back in touch with you. Thank you again, Marion and Claire, for joining us tonight.
Thank you.
Take care.
Thank
Bye-bye.
you.